I'm Whitney Dean. You're listening to Talk to the Experts News Talk 770 with Clarity Laser Vision as we talk about corrective eye surgeries and eye care that are available. Website claritylaservision.com. That's claritylaservision.com. Dr. Al-Ghoul has been answering our questions, but also he works in another place. I know I'm going to confuse you here. SEMA Eye Care. So SEMA eyecare.com, and that's where he also deals with cataract surgery, ophthalmology, transplants. He really knows eyes. So is this where you started? What's your background?
Well, I grew up in Saskatchewan most of my life, and then I did most of my training there. Then I went out to Pittsburgh and did a fellowship in refractive surgery and corneal transplantation. So when I initially came to Calgary, my focus for the most part was to try to ensure that we bring in the latest technologies in corneal transplantations, in dry eye management, in various things that are much more widespread for our public. And thankfully, I've been blessed to be able to bring such technologies, like things like, here comes the little acronyms again, but things like DSEC, DMEC, DOLCs, all these fancy terms.
Yeah, what does that all mean?
I think these are all essentially modified versions of transplants that I've been fortunate to be able to bring into the city and help essentially propagate it and help a lot of our patients who have been dealing with these issues. So again, sort of much like anything in medicine, there's a lot of evolvement and refinement that happens over time. And so these technologies are about sort of minimizing the amount of tissue that you need to remove and replace. And now we're talking corneal transplantation. We're not talking corrective eye surgery, but again, it's the same structure. We're talking about the cornea. So as a structure, that I essentially spend my whole day dealing with this 0.5 millimeter structure. Wow. Every day of my life, basically. And you get to know a lot about it. You get to respect it in many ways and understand a lot more about sort of who would be a candidate for something like corrective eye surgery because of the fact that, every day I'm in the quote unquote trenches, dealing with the various pathologies and offering things that are beneficial to my patients who have these diseases. So the SEMA Eye Care is essentially kind of my flagship to do a lot of those things. But we do a lot of comprehensive care there too, and I have other associates who work with me, a lot of other ophthalmologists who are there as well.
So I guess what are the outcomes then after, whether they're at SEMA Eye Care or Clarity Laser Vision? What do you hear from patients once they finally have that outcome that they've been looking for? Because I think for a lot of people, when you have eye problems, after a while, you get used to, I think, putting up with poor vision or the problems that you have because you just learn to manage because you have to use your eyes every day.
Well, I think we're very fortunate to be living in the era that we're in because there's so many technologies that essentially, I would say have revolutionized our outcomes for our patients. I mean, I could tell you that I'm addicted to having 20/20 vision for my patients. This is something that I kind of focus on to try to get that constant outcome. Yeah. And, almost like I equate to try to hit a home run every single time, right? And I love it. I think the fact that we have so many options now to be able to achieve that allows us to be able to have very, very high success rates of that. I would argue comfortably more than 95% of my patients who are going for corrective surgery end up with exactly what we want to do. And the less than 5% are those who are not that far off, and we'd have to sort of decide, do we do touch-ups or do we just wait it out? And sometimes even in that 5%, over the next few months, they come back to being where we want them to be. So, when you have such high outcomes, honestly, that it's a very comfortable discussion that I have with my patients about expectations. Now, again, medicine being what it is, and I think that we have to always make sure that we set the right expectations. So I always tell my patients, look, there's an 80% chance I'm going to give you 20/20 and 90% chance I get you 20/40. And I say that because I want to set that expectation, sort of understanding that, I have to be humble about the fact that this is still, a structure that I think I know it all, but there's some aspects, i.e. the genes of how that eye is, that maybe will allow things to heal slightly differently in terms of the outcome. So we have to sort of prepare for that. But again, with that said, I would tell you comfortably, the far majority of my patients are seeing fantastic, whether it's actually corrective eye surgery or other things that I'm doing in the eyes.
Yeah. So I guess for a lot of people, they wonder because they think surgery and they think, hurt and pain, discomfort. What would you tell those people?
Well, here's the thing. I think the reality is there's risk to everything that we do in life. You know, we drive a car every day. You know, an accident can happen along the way. And when you're a corneal specialist, I deal with the accidents of things like contact lenses. I mean, I tell you, a big portion of my practice are from patients who, you know, are doing everything right sometimes, and still they get complications from things like contact lenses, sometimes from other things that are no fault of their own. So I'm not saying that contact lenses is not a great option. I think it's a fantastic option, and I think it's a great option for a lot of people. What I'm saying is essentially that, you know, whether it's whatever thing makes you comfortable, you have to understand there are pros and cons to it. So corrective eye surgery is no different than wearing contact lenses in some ways. I mean, there are you know, pros and there's cons, and you have to be comfortable with the reality that, yeah, there are complications that could happen. And the good news is, you know, as a corneal specialist, I deal with that all the time. So we're constantly making sure that when a corrective patient comes through, I mean, we give them our direct contact number so they can call us if there's any problems. You know, we check on them, you know, constantly as they recover. We're essentially there, you know, 24/7 for them to make sure that, you know, nothing really happens along the way, to again maximize that comfort and the recovery period.
Now, some, they have a short recovery period. Some, you do try to have people budget a little bit longer. How do you talk to people about fitting that into their lives, or what they need to expect as they go back to work or get back into their life?
You know, if we take it back to like corrective eye surgery, I mean, I think essentially when you look at the discussion that I usually have is that with surface ablation, I say, look, expect about a 2-week recovery. It's honestly really rare that by 1 week, my surface ablation patients are not at a point that they're functional. But with LASIK, I tell them, look, expect about a week. And I usually tell them, look, tell your employer if it's going to take a bit more just to kind of prepare for that possibility. Although, again, thankfully, that's extremely rare. But that's usually the discussion that we have. And all the other technologies we talked about are really honestly in that time frame as well. It's rare that someone requires more than 2 weeks to be able to say, hey, I need to go back to work and I'm not able to.
Do you also find over the years that you've been practicing that because of the more technology that you have available, that more people are qualifying now? Because I think before, a lot of times people thought, you know what, it sounds like so many people get turned away. I'm not even going to bother because who knows if I'll even get in for any of these options.
Yeah, I mean, I was sharing with you a story earlier. I had like a patient of mine who was minus, I think, 14, right? And so that's someone who, you know, you would have never thought possible they could have any solution for the problem. And they have been to other centers that said, look, I don't think there's much of a solution for you. But, you know, we were able to assess their situation and ensure that, first of all, they're absolutely in a great condition from a health perspective, both systemically and the eye point of view. And then we went ahead and did an ICL technique where we put the contacts in their eyes. And the next day, they were already at 20/20, the next day. Yeah. Now, that is someone who, like, I completely agree with you. Like about 10 years ago, you would have said, look, I just don't know if we really would have had an option. And that's the beauty of anything in medicine, is that we're constantly evolving our techniques to be able to offer more and more options for patients who, like you said, traditionally may have been not a candidate. But, you know, we're not shy about saying that you're not a candidate for someone. I mean, if we see that someone is not a candidate, I think that, yes, we have expanded our scopes of what we can offer, but I think it's really important to, again, take it back to the fact that, you know, as a corneal specialist, you know, I got to make sure that ultimately that it's safe to do this procedure for our patients, right?
Well, you are a doctor. There's, you know, ethics and standards that you have to follow. Even like your clinic, you guys have very high standards that you have to meet in that clinic.
Yeah, absolutely. I mean, I think the other thing that we really wanted to ensure is that we wanted to, you know, make sure the more the experience is top-notch at Clarity, and that's why it's a separate center completely dedicated to just corrective surgery options, essentially, right? So that's why we have SEMA Eye Care on one side, but we have Clarity Laser Vision on the other side. And so we're wanting to make sure that the experience is top-notch for the patient, but also the standards of what we put in terms of the facility is truly the highest standard from a point of view of sterility, of humidity control, of various things that, you know, one can argue you don't really you need to go to that extent, but we did that. And the reason we did that is because for the same thing I told you earlier, which is really, if I was going to do this on my own family member, how would I do it? And that's the thing that I kind of keep harping on. Whenever I kind of think about Clarity, I wanted to make sure, again, that anything I put in, I try to get the maximum potential benefit out of it. Even though, it may not be a huge benefit to have a room that's got 100% humidity factor control in it, But at the same time, I know that there's even more precision in the lasers. The lasers are very sensitive to humidity. So we went to that extra measure to make sure that we have complete control of that humidity factor. And again, that's something that that's just my nature. I like to kind of do that.
Well, you're passionate about it, passionate about eyes, passionate about the clinic, and we've been learning a lot about it. Dr. Ahmed Al-Ghoul is the founder and director of Clarity Laser Vision. We've been talking to him, claritylaservision.com. That's claritylaservision.com. We'll have more from him in just a moment. I'm Whitney Dean on Talk to the Experts on News Talk 770.